Well, there are now more than 100 cases of measles in 14 states across the United States and Mexico. The outbreak, of course, renewing the debate whether the federal government should mandate vaccinations without exceptions. Erin Tolbert is an emergency room nurse practitioner and the founder of Mid-Level U. She joins us now with more on this story and some of this week's top medical headlines. We're thankful that you're here.
Thanks for having me.
You see these things come right to you. You know how serious disease can be, injuries, etc. When you hear about this measles outbreak, what is your perspective? Should we be vaccinating our kids?
Yes, certainly 100% parents, you need to be vaccinating your children. The risks of the vaccine, about 1 in a million children have a serious reaction. However, 1 in 1,000 children could die if they get the measles. And so the risks of vaccination here are far, far less than the risk of getting the actual disease. And so you really want to be sure to vaccinate your children, vaccinate them on time so they aren't exposed at school. We see big pockets of children going unvaccinated, and this is a problem we really need to address.
Yeah, when you say big pocket, you're not exaggerating there. California, where the outbreak started, 75% of kids not vaccinated in some schools. This is a tough one. And then you have this is where it's all kind of coming from, where parents are getting their information. There's a new study from Washington State University that says internet comments can be as persuasive as the CDC when it comes to vaccines. So people are going online, they're hearing some blogger's opinion about don't vaccinate your kids, and then they're listening to it just as much as they would listen to the CDC. What do you think about that?
Right. Well, we saw this in 1998 when this flawed study on autism came out. Everyone was listening to, for example, Jenny McCarthy talk about vaccines, but they weren't looking at the actual data. And so it's really important to get good, hard scientific facts. Talk to your healthcare provider about getting vaccines rather than looking online and getting that misguided information that we commonly see. There are no studies that really link vaccines and autism. They're not related whatsoever according to science. And so unfortunately, parents are really getting misguided information when it comes to the internet on this.
So you're saying they're hearing the fear, but they're not getting the facts.
Exactly.
Okay, good note there. Hey, what about this? So there's a study that's showing hospitals are a bad place to suffer a heart attack. Erin, you're there as a nurse practitioner. What's going on?
Yes, so this study shows that, unfortunately, the death rate is 3 times that for people who are admitted into the hospital. They suffer a heart attack while they're already there, rather than coming in through the emergency department. And this is because, just like you at home might have a fire drill, or at work you have a fire drill, we have sort of heart attack drills in the emergency department. So we know exactly the steps to take. They're timed for when we have patients coming in. But we're not doing this for patients who are already in the hospital. It's taking us twice as long to get them that life-saving treatment that they need. And so we really need to get those protocols in place, not only for the emergency room, but also for the inside of the hospital as well, that hospital floor.
Do you see that this will maybe trigger that reaction and get those protocols in place?
Certainly. Awareness is always the first step of the problem. There's a group of 12 hospitals that are working on this issue. They're educating nurses. They're looking at the procedures and policies we need to get in place to help treat these patients a little bit better. We need to be getting them EKGs more quickly. A lot of times we're seeing this happens to women who might have atypical symptoms.
Sure.
So we really need education, better policies here.
Well, we are glad that you are here, Erin Tolbert, founder of Mid-Level U and nurse practitioner with the real information. Thanks.
Thanks for having me.
This coming up, Homeland